One question that we commonly get is, what does a chiropractic adjustment actually do? And I'm going to share with you the 5 things that it does right now. Number 1 is it causes a release of pressure. You've probably stretched first thing in the morning or after sitting at your desk for a long time and you get a little popping sound. That pop is a release in pressure between the 2 bones where they come together. There's actually fluid in there, which is how you're able to move without friction. But as we do an adjustment, the pressure inside there changes, and so we naturally get that release in pressure buildup. Number 2 is we increase range of motion. Every joint in the body, including the spine, should be able to move a certain amount, right? I'm sure we all know somebody, or maybe it's even you, who has trouble looking over one of their shoulders, right? Especially while driving, which is a little bit of a scary thought. But you should be able to look almost all the way over to where your chin is close to that AC joint at the side of the shoulder there. As we do an adjustment, we can increase range of motion in those joints. And as we do that, that actually leads right into number 3, which is we get increased blood flow and nutrient delivery. The spine, in particular the disc, the tendons, the ligaments that connect all of this together, and the joints themselves do not have great blood supply naturally, okay? So as we do adjustments and we improve mobility, we also improve nutrient delivery to that area, which leads straight into number 4, which is as we do that, we can actually slow, if not arrest, the degenerative process. The reality is that all things that are mechanical wear out over time if they're not given correct maintenance, which is why you take your car in for oil changes. That's why you go to the dentist to get your teeth checked, and the spine works the same way. So this is an example of a degenerated spine where we've got all this spurring. You can see there's really not a whole lot of room left in between there in the disc, and the joints, typically with this level of degeneration, you will naturally see less range of motion, which also means less movement and less nutrient delivery. So we want to try and slow this process as much as we can. Last but not least, adjustments stimulate the nervous system. You can see here, this little hole between the vertebra is where that nerve root comes out. We want to make sure that that is wide open and that this vertebra is not inflamed and that those joints are mobile, and that helps protect that nerve to be in a good environment so that it can function the way that it should. So really, the simplest way to say it is chiropractic care is about making sure those nerve holes stay wide open so that those nerves can function and that you can have the mobility that you need so that you can age as slowly as possible. And that's what a chiropractic adjustment really does.